All right, Mr. Watts, you're good to go.
All right, sounds good. Hope everybody's having a good Wednesday afternoon now. And so we will officially call to order at 12:03 p.m. And I will ask Ms. Jacinta if you will help us with the roll call. And if you're talking, you are on mute.
Jacinta?
You may have lost her. I did see her.
Holly, can you just go?
Yep.
Okay.
Thank you. We have Marcus Johnson.
Present.
Corey Melton.
Here.
Eddie Gonzalez Lumiere.
Present.
Mr. Terrence Watts.
Here.
And Mr. Darren Toston.
We did get notification that Mr. Toston would not be able to make it with us today, so.
That is correct. You have a quorum, Mr. Chair.
All right, awesome. So you should have received your packet through email from Ms. McPhail. And so if you've had a chance to look over the agenda for today, which we will cover a lot, I would need someone to make an approval of the agenda. Today will ultimately be the day that we will try to finalize the work plan that we first reviewed and initially discussed at the last meeting. We'll review a few additional items. There's a draft information systems map, a part of the packet that Ms. McPhail emailed us, and then also a list of technical requirements to support the map. We'll also discuss some recommendations for the procurement evaluation and negotiation team. So if I can have a motion in a second, we'll dive right in. Or if we have
motion to approve.
All right.
Second, Eddie Gonzalez Lumiere.
All right, Marcus Johnson motion, and we got a second by Mr. Eddie Gonzalez Lumiere. So we will move on. Are we aware of any public comment request?
I'm not aware, but I do see that there's someone in the waiting room. So I'm going to let them in. And I think that they're here in an observation manner. Oh, maybe they were incorrectly in here, not sure. Okay, we have no public comment, Mr. Chair.
Okay, all right, no worries. So without any general public comment, we'll dive into number 5 on the agenda, which is work plan finalization. And before we discuss that, there have definitely been some feedback collected from the community and some community comments, events from some of the sessions that the CSC has been holding. And from those discussions, definitely obtained some feedback that we think would have the potential to likely impact the direction of this plan. And so I wanted to make sure that we had an opportunity to share some of that information with this group because it's going to be likely imperative that we get the expertise from the group of how we incorporate some of that feedback into the direction that we take as far as the system and the software. So Holly, is this a good time? Can you kind of elaborate on that for us?
Sure, and I'll also just kind of ask Sika to weigh in as well, because, well, she's been facilitating those conversations. We've had the opportunity to host so far 3 very informal community conversations, 2 with, I'm going to say, adults, because I don't want to just say, you know, community members. Many of them were in fact providers, and 1 directly with youth. And in those conversations, they shared some of their barriers and frustrations of accessing services, and some of the ideas when Ms. Green would talk about solutions lent itself to potentially the use of some sort of electronic data system, something that could potentially solve some of those issues. A lot of them had to do with navigating services and knowing what's available. So as you guys know, we are in the middle of doing a needs assessment right now, and we're developing an interactive comprehensive programs inventory that we'll actually be demonstrating tomorrow at our program services committee. The idea is that tool will eventually live on our website. So one of the questions, of course, that we have already discussed is how do we integrate that I'm going to call it a navigation tool into this system that we're talking about building. But what's more than that is that they were talking about if they know that they need services for something, would there be a way that they could log into something and be able to get access and information, not just a phone number? So oftentimes when people call, I'm going to pick on 211, and I'm doing that only because we're having a meeting on Friday to talk very specifically about this issue. But if they call 211, they might be given a phone number or a verbal referral, but not necessarily an actual, here, let me call this person with you, what we like to call this warm handoff. And oftentimes families are having to go to 4 and 5 different places, asking the same questions and not, sometimes they're accessing services, sometimes they're not. So we've talked a little bit about this idea of case management for the programs that we partner with, that they could be able to use our data system to do some data collection and maybe a little bit of case management. But we haven't really talked about how a member of the public might be able to utilize this system. In addition, when they go to all those different agencies, there is a struggle for them to have all their documents with them that they might need. So one example that was shared with us had to do with youth seeking employment, that they might not have the required paperwork. Maybe they don't have their social security number because they don't have a driver's license, or they don't have a driver's license because they don't have their social security number. They can't get their social security card because they don't have a copy of their birth certificate. Or once they do get these, then every single time that they go to a new place, it's like they're having to share this. Or a family might be applying for a subsidy and they have to provide paychecks or stubs. There's all these different things. And what the question came up, wouldn't it be great if like they just had like a digital passport or a digital, that was the term we were using, right? Seek a digital passport. And so this is the conversation that was generating and the decision or the discussion of, could that element of interacting directly with families or having a digital tool directly interacting with families be part of this system that we're designing? And say, for example, if in our comprehensive programs database, there's some sort of data sharing agreement that a family goes into organization A and they say, oh, I need X, Y, and Z. And they could just open up their app, select X, Y, and Z, and consent to share those documents, or for that organization to view those documents, and kind of be able to create this interactive tool. So that is kind of in a gist what was being discussed. Sika, I'm going to ask you to kind of just add any additional thoughts to that. And the reason why we're bringing it up now is before we go into finalization of a work plan is, can this be incorporated? So Sika, I'll turn it over to you.
Yes, thank you, Holly. I think you summed it up pretty well. So looking at some sort of digital way for families and youth to be able to have electronic access to their important documents so that they don't have to keep being replaced when they're lost. And then also, as she said, some sort of sharing agreement, MOU, requirement might be too strong of a word, but we could require that if you receive funding, if a provider receives funding from the CSC, then it is a requirement that they have access to this digital wallet, if you will, so that they are able to see the documents that are necessary to be able to help the families, A, and then B, the families aren't trying to keep up with documents, and then C, having to pull the documents out every time they access services. So it would have to be a component of some sort of enterprise system, some sort of web-based system. I believe Miami the CSC in Miami may have something similar. I have not seen that yet, but through some conversations, I think they have something that is similar to this. But that did come up in our community conversations and in some conversations that I've had one-on-one with a council member or two.
Well, you answered my first question, which is, do we know if anyone else has something like this? And I have heard before in many different places how all that documentation for the folks that utilize any of the services, especially any of the federal dollar things, it's an enormous challenge and barrier. But it did immediately make me think of, like, you know, Apple Wallet and Apple Pay. I mean, the technology is there. Just is it attainable for this?
Yeah, I agree with Corey. You know, I think we've all experienced this in the medical world. And I know dental has been a part of several articles, which I totally agree with, but we've all experienced where, you know, you go to a doctor's office and then they refer you down the street and you have to take papers with you. And the medical field, you know, especially over the last couple of years, has advanced technologically. I mean, when I think of something like this, and I think one of the key words is interoperability, but I think we have to remember that our house has to be in order first, right? Because you can have all the interfaces in the world and you can create external facing websites that, you know, folks like myself can go on our phone and look at. But if our house is not in order, then you've kind of, you know, multiplied a challenge. There's a multiplier effect. So then you have, from an integration perspective, and we've talked about this in the past, I believe, you know, having the system be able to integrate with third parties is extremely important. However, sometimes people say, you know, Eddie, if that third party doesn't have a technology system to be integrated with, sometimes that's even easier because then that third party can use a CSC solution, right? So you may go to an organization that doesn't have much technology, so there isn't really an opportunity to do an interface, which can be, you know, several hours of work. Well, in that case, CSC's application solution could be provided to that third party, and now they have something. So that's something to keep in mind as well. Related to parents and children, many of these solutions, I believe, should have the capabilities of, you know, having an internal view, right, for folks at the CSC, the staff, and then of course having an external view of the data, and that is, you know, totally normal in many industries. I think the keys there, and I think everyone on the phone call can agree, is cybersecurity is extremely important because now it's not within just four walls. It's open to, you know, potentially hundreds and thousands of people. And then the account management process, right? How does Holly McPhail, how's her account, access and get, you know, given her credentials, what can she look at? I mean, she can look at the McPhail households, for example, information, but she can't look at Gonzalez Lumiere. And so just having a process there, usually that requires a process and a standard operating procedure on the staff of the CSC, for example. And then, you know, one of the things I've seen in healthcare as well is an opt-in model, right? So, of course, you have the requirement type model where it's mandatory, or you have an opt-in model where, you know, if you go to a doctor's office, they'll tell you this doctor's office is a part of a health information exchange, which is a community of providers. You, Eddie Gonzalez Lumiere, have the ability to opt in, which should make your life easier when you go to Radiology and Associates, when you go to TPCA, TMH, CHP. And so you have like this opt-in model, and usually people will click on it because that's what we usually do, right? Click and sign. But then you have one login to access a portfolio of resources. And so once again, in the medical field, you have this protected health information. And in our field here, it's also very sensitive information. So cybersecurity is of utmost importance.
Can I ask a quick follow-up question on that?
Yes, go ahead.
You talked about the health information exchange kind of network, and you used that great example here in Leon County. Do you, and I know that the medical world is more in your background than perhaps anybody else here. Do you know how those systems decided, I'm assuming it's through some sort of the electronic health record, but having all of those organizations decide that that was like the opt-in model from the family, or, you know, from the patient perspective, Is there also an opt-in model from those providers, like, radiology associates, CHP, TMH? Are they opting into that same system? Is that how it works?
Great question. So part of it goes back, 15 years, where there were grants associated with participating in a health information exchange. There were incentives. And then eventually it was a requirement where you, as a provider, a hospital, a doctor's office, you had to participate in a health information exchange and create the connectivity and the interface. Then at that point, it's up to your patients if they want to be part of that or not. So there was some state and federal guidance around the data exchange, but I will tell you, Holly, participation is not where it should be, right? And it doesn't matter what administration's in office. There's just a lot of challenges because we tend to create data dungeons or silos within our organization because it's kind of scary to share information with other people and other organizations. And so there's been some challenges there, but a lot of lessons learned as well. You had mentioned also, or folks had mentioned, the wallet. And there are companies now that are coming out for healthcare. I think one of them is called Life Wallet out of Miami, and it's very popular, where I can have all of my medical records on my phone. And there's integration. So, it's not as advanced as it should be in healthcare, but, I think COVID, one of the positive things about COVID, I think many people realize, is that sharing of information can ultimately save lives. And I think that's very relevant to, what we're trying to do here with these types of services. You can change someone's life if you share with other organizations. And so we have a great opportunity here in Leon County, where it's not a massively huge county. And you can run pilots, for example, where you can set up data exchanges with different organizations. I will say oftentimes especially in healthcare, there usually is one organization that's kind of the hub, right? And the question is, what organization is going to be? It could be the CSC, where you're kind of the hub and you're the coordinator, and you onboard organization after organization. And suddenly, if you're a part of this hub, you can then share information with anyone else on that hub. It's like the hub model, right? So I can have an organization, a nonprofit in town that connects to a system, potentially that CSC, sets up and makes available. And then that third party can then exchange data with anyone else that's on that system. And that's that hub model, which is a lot easier than point to point. Having point-to-point connections between all the organizations. I mean, that's just not sustainable. And so really the job is to create one interface with this hub. And then from there, you have access to share data with anyone else in this hub. And I think that's a very, potential, great model.
Have any of you or are any of you familiar with the Sheriff's Spirit program? I don't know if that's would be anything to use here or not, but I just know that it's similar in effect.
Yeah. So I have met a couple of times with Sheriff McNeil, and we are actually going to arrange for them to demo the Spirit portal. Now, my understanding is that the Spirit portal is actually a portal where providers can sign up to be a part of that portal, so that as juveniles in particularly come in contact with law enforcement, there is a way for them to go in and look at those providers to be able to offer services, diversion, in some cases prevention. And I know that they are forwarding the use of that portal and trying to get as many community providers to opt in to becoming a part of that portal. We are also arranging that they come and demo that and talk about that thought process and what their all-in campaign in conjunction with Spirit is trying to accomplish, particularly for men and boys in this community, which I know is a big focus of the Sheriff's Office. They do not have a component of that serves as a wallet of type. So I do know that that does not currently exist in that portal. And so this would be a new concept in Leon County. And what I see is, so first, let me start by saying that I totally agree with Eddie in that this would come out of what we already have in place. So we have to make sure that we've got the first pieces of what we need to manage the CSC in Leon County, manage our investment partners first. And this would come out of that, be a part of that, or a word I like to use, an accoutrement to what we are already doing. So this is kind of the beginning stages. And the reason we bring this up is as we look at what our solution will be, understanding, or I think we'll have some discussion, that this will be a multi-year type of thing. We would determine at what point we are ready to roll into the establishment of this, then the testing of it, then that, the appetite. We of course meet and talk about the appetite, because I would want us to be the hub of that. I do not see CHSP, for example, being the hub of that, because you're talking about city and county government. That's too large of an organization or organizations that now need to be responsible for this. I think CSC is the right size organization for Leon County to be the hub of this information, and then work with our providers. Maybe it would come to a point where CHSP would require, I'm just throwing this out here, would require that anyone that receives funding from them would have to opt into this. Maybe United Way would say the same thing, North Florida Foundation, Leon County Health Department, and so on and so forth.
So I was the referral intelligence tool, which is what Spirit is. We have that one, as well as there's one in the housing world that we know about, that the continuum of care kind of manages. They don't operate the same way, and I believe that Spirit has more of that kind of personal connection where a family can actually help navigate it. But both of those, in essence, are that referral intelligence tool that 211 is definitely interested in learning more about. And I think that even there's funding related around Help Me Grow that could benefit from that. So I think this idea of the hub, and I think you even said about like maybe even piloting it. Well, we know that Spirit and the juvenile prevention is more of kind of like that diversion. It's intended to be a prevention tool, exist. And so having that connection of, is it something that if we build it that could integrate with that? So they still have theirs, and that we're not being duplicative, and we're also not reinventing their wheel for them, but that it can connect. In essence, to go back to one of the terms, Eddie, that you've used before, is that data lake, the data lake concept, right? That in essence, like that's the hub. And if they opt in, so if the COC has theirs and the law enforcement has, or sheriff's office has theirs, can that all come back into that bigger hub? And right. Do other ones exist? I know that I want to say that Leon County Schools is working on one that's with fiddlers related to screening and assessment. There's something that happens there, so there's something like that. And Mr. Watts, you were telling me about, it's Aunt Bertha, right? How does that fit into this idea that we're talking about?
Well, so DCF has the My Florida, My Family portal. And this is an attempt to any provider out there, resource out there, can sign up into this portal for it to be, if you will, a one-stop shop. And if someone has a particular need based on zip code, they should be able to go to that portal, put in that zip code, put in the particular need that they're trying to find, and it should populate what resources are out there for that particular zip code, okay? And if there are certain providers in there, so if I'm a provider, I'm working with a customer, and I want to go in there and find that resource, potential resource for that customer, I can then actually refer straight through that portal, that person to that resource, because I have an account set up. So what, and Bertha powers that platform. And so, so what Aunt Bertha does for us is not quarterly, but maybe like monthly, they go over the data and give us a report of how many people are touching the website, how many referrals, which group is referring, so there's a couple of people that are tied into it right now that can refer to different organizations. So it's how I describe it's like a 211 on steroids. It's just, and it could be 211 as one of the resources in there that we refer to. But that's who's powering that is Aunt Bertha.
And then, if I may, because I don't want to belabor the point, because I know we have to get through an agenda. And then there is a totally independent one that we talked about last time that is backed primarily by HCA, that is literally trying to do the same thing, get all the providers in so that there's no wrong point of entry. So I think the other thing that our CSC has to decide, do we then want to try to create another one? Or do we want to look at how we either feed into these other referral portals or somehow connect them all? Because what I don't want, CICA, do not want is for us to reinvent wheels that are already out there and already working. Maybe it comes to picking one or two, and those are the two that we forward, support, encourage, whatever that is. And I'm not saying that has to be the option, but I do know that I believe our council would definitely be averse to us then now creating something else. I think what I say all the time is my goal is I want this council to change the way that we look at providing services for our children, youth, and families in Leon County. Change how that looks. And that can look any way we want it to look, as long as it comes together and it works well and seamlessly, if that makes sense.
It makes total sense. And I think it's a good segue. Great discussion so far. I'm going to say, because we're going to look at, we had some recommendations for a revised work plan. Okay. Well, that's on page 6 of the packet. But a few things that Eddie and Corey brought up, and Sika and Holly. When you're talking about the interfacing, and Sika retouched on it again about, how we start off, like how we start, and like this is a component of that. Do we think it's unfair? So when we're talking about the RFI and what we've been reviewing, do we think that some of this discussion of what we're referencing has to some way now find its way and be very articulated in the RFA in the process, or so in other words, is there possibly a group out there, an organization, a company, or whatnot that chooses to pursue and pursue this be our system, our solution? Is this something that can come afterwards, or do we need to reference this now? Okay.
If I may, Mr. Chair, I'm going to jump just momentarily on your agenda. I think that it's a great question. This is the start of that information systems map, kind of building off of the one that we shared last time we got together with a sample from St. Lucie, making it specific to us. I have referenced over here Paychecks, which is what we're currently using kind of for this part, this human resource part. And kind of, we have Send in Blue, that's our current our current email distribution. We have the ability for starting to collect these lists and things like that. I would say it's our current CRM for lack of a better term. What's missing from this are these components about a referral intelligence tool and this idea of the wallet. That's not mentioned anywhere on here. And I think what's also missing from this is a little bit of some of the Power BI tools that we've talked about, display functions, but we can work that in there. That would probably come and integrate with the website and through our Office 365 and our Azure network that we've established. But this was kind of like the start of it. So I think that everything that's in the packet that you'll review today is to support this and nothing beyond this. And so I think that the question comes if we want to do these other things. And I think this makes me go back to a comment that Mr. Johnson made at the last meeting of setting priorities for year 1, year 2, year 3. Are what we're talking about now with the referral intelligence and this hub concept and the wallet, are these year 2, year 3 types of year 4, year 5 types of projects that we can deal with separately, or since we're having the conversation, should we incorporate it into this process?
Let me throw this additional piece on there. So if let's say we just focused right now on what we had and that's the direction we took, would it be kosher or appropriate or inappropriate if we were to throw in at this stage or request information of how these companies might be able to support down the line a referral intelligence process?
So if I could jump in, I think the visual, so we didn't get that visual in the packet, but I think that visual sets up what it is that we currently have going and how we see it and the need for some sort of system, integration, whatever you call it. So, because we could end up with a system that says, oh my gosh, we integrate with paychecks all the time. You don't have to get rid of them. We'll just integrate with them. We could easily get that. Or we could get a system that says, we could integrate with paychecks, but we also have this system that will work. And at whatever point you're ready, we can add that on. The only way we're going to know that is if we show everything that we're trying to do. You know, it's like in a house. I'm going to tell the builder everything I want. And then he's going to say, how much money do you have? And I'm going to say this. And then he or she or they, because I want to be real good about my pronouns. He, she, or they can say, well, for that amount of money, pick what's most important. And then we'll keep this in your expansion plan for when you're ready to move to that expansion. So what am I saying? I'm saying I think we add in the passport wallet and we add in the referral intelligence tool, knowing that that's not going to be something that comes in year 1, year 2, or maybe even year 3. It may be further down the road, but it gives us, but when we issue that ITN, at least the respondents know, I need to have this in my response. I need to give this some consideration. If I can do it, if I can't do it, if I want to do it, or if I don't want to do it.
I agree. I think the scaffolding has to be there, and I almost see in the diagram, Holly, like an integration layer just around everything, because we may not integrate with many third parties day one, but we have to have the capabilities to be able to do that in the future. And it should not be something that is super burdensome, and it shouldn't be a whole new project. It should kind of be in that ready position, because also new organizations will pop up, but we should have the tools available to be able to interface with third-party applications without having necessarily to call the vendor and creating a whole new proposal. And what my fear is, and I think several folks have alluded to this, is they implement something and they don't consider that in the beginning, because they may have to update their API documentation or something like that. And we should have the ability to expand without, having to go through another system selection process.
Okay.
Exactly. And I also don't want us to end up in a place where we didn't give all the considerations of what we're thinking. Now, of course, over the course of the CSC, over the course of this 12 years or 10 years before we go up for reapproval, new technologies could come on board. There could be new things that happen. I think we need to allow for that. But I think by presenting the Bentley version, I was in LA and I saw a Bentley SUV, which I didn't even know existed, right? It's like $250,000. But we present this Bentley, understanding that right now we're probably at a Buick, maybe a Hyundai is what we can afford in year one. And then as we get into year two, maybe we're able to upgrade to a Genesis. And then, but it allows for the expansion and the integration, because what I don't want is for someone to say, well, you have to get this whole package over here, and no, it's not going to talk over here, and no, we can't create an API to make it talk. Then we end up with all these separate entities, literally, they can't speak to each other. And that's not going to be good for a small staff, of which none of us are these IT, gurus.
Yep.
May I ask 2 follow-up questions building off of that? So in essence, what I hear us saying is that we want to go ahead and dream big and let's build this out. So as we go into the conversation, looking at the work plan, clearly we're going to need to do some edits, and I'm really glad that we didn't, Terrence, I'm really glad that they didn't approve it at the last one, since now we want to go a little bit bigger. Thinking about this intelligence referral system, the referral intelligence tool, and the idea of the wallet, and I love that you guys mentioned and called it like the Life wallet and the Apple wallet. Those are 2 great ways that, in kind of going down and pulling information from to at least develop the ITN and the list of system requirements. Will be helpful. Eddie, you said kind of the peripheral. Can you guys share some of your kind of initial thoughts or ideas on how behind the scene kind of coding it might, like where it's going to touch and integrate? I assume it would be somewhere in the program providers vendor portal, maybe, or maybe in the CRM. I get nervous about attaching that wallet to the CRM section. While the CRM can do great grouping and relationship management, oftentimes it's user-based, like it's per a fee per user. And some of the demos that we've been doing thus far have talked about, I'm going to use Salesforce, since I'm not talking to Salesforce, but some of the solutions that are being offered are built on the Salesforce platform. The idea that for every contact that you have in that database, it's just a contact. But if they have an ability to log in, upload, do things, it starts to become potentially, right? We could have 100,000 users touching this system. So I'm curious, from an infrastructure kind of behind the scenes background, that flow of information. I was trying to, for example, see here Office 365, it flows up into the CRM that would then maybe touch into our kind of our social channels, our distribution channels. Same thing with, the human resources stuff. Clearly that's going to be tied into our fiscal ERP. The fiscal ERP with our funds management is going to be connected. So I was trying to understand that a little bit more. So what are your thoughts on this idea of the intelligence tool and the wallet, of where it touches and how it integrates?
Yeah, it's a great question. So I'll give the example of COVID-19 reporting, right? Every state in the US has their own database, and they have to report to the federal government. And so what's in between the state and the federal government is a data lake. And so people interact with a data lake or a different database, and we'll ping that data for the wallet, for a report, for Tableau, for third-party applications, and they're really not touching the original database. And so you can almost have, and this is really a good question for the solution providers, is how would you set up an interface without impacting the actual data that's being used by the staff, for example. And so, you have this like real-time copy type of situation. And so you would point, a wallet to that data lake. You would point Tableau to that data lake, SAS or Power BI or, pull reports, and you're not impacting not only the quality and the actual data in the main database, nor the performance, because that's another thing. If your staff's in there working, you don't want someone to start querying the main database. So that's an option that I've seen, and that would be a great question for the vendors. How would you set that up in a way that is secure, doesn't impact the actual root data, the original data? How do they set it up in a way that it's real time? So if you have someone on the phone looking at their wallet, quote unquote, and the staff members looking at the main database, that it's the same, right? So it almost has to be real time. And these are things that are out there. And I look forward to seeing what the, vendors have to offer.
I'm going to repeat that, a part back to that. Instead of trying to create these almost like linear connections, it's like basically reimagining this visual altogether of the components that are held in there, and they query down and up. But
yeah, you can have
but then to include in the ITN the request of how would you construct all of these interfaces? Like how would you design it?
Right.
Okay.
Is it a data warehouse? Is it a data lake? And you're really creating your own little hub. And there will be an integration layer on top of whatever data lake or data warehouse is available. And how that integration layer will be set up is important from the beginning, because we don't want to reach back out to our partners, future partners, 6 months down the line and say, hey, we've got an interface, and then they have to come back and rewrite the software. And so the integration layer is really important. And I don't, in what I've seen in the past is some interfaces require the vendor to actually do the interface. It would be great if staff could, with proper instructions, could configure interfaces on their own. What we don't want is to receive an invoice every time we have to create an interface, especially as we're trying to, communicate with our community partners, parents and children. It should be I always like to say an interface is an interface. It's not necessarily a full-fledged project, right? And so hopefully that'll be articulated in the responses.
Well, thank you for that. Any other kind of comments on that?
I don't have any comments. So Holly, I guess and Sika, you guys want to look at the current plan now, or what are you guys proposing as our next steps after that discussion?
I would suggest that we look at that work plan phase based on this. And kind of the addition, especially the addition of these more, I'm going to say public, I'm going to call them public facing elements, and where we would fit that into that work plan phase, and talk through a reasonable timeline for the addition of that. So that would be going into your packets.
Okay. Holly, are you able to, oh, go ahead.
No, I was going to say, I would agree. I'm just trying to grab a quick bar, and I didn't want everybody on Facebook to see me eating. But I would agree with what Holly is saying. Okay.
Do you want to share that page or? Okay, perfect.
Sure, I can do that. Give me just a second. It will be right. Oh, I'm looking in the wrong folder. I thought I had it open, but it was just the agenda and not all the background stuff. Okay, and apparently I keep pulling up last month. Give me just 1 second. I'm so sorry, guys.
Holly, can I clarify something around interfaces?
Sure.
Okay, so when you talk about paychecks, when you talk about solutions like DocuSign, solutions like Salesforce, Office 365, naturally, those are enterprise-wide solutions that are pretty popular, and they will provide pretty good documentation to create an interface. I think where I'm a little concerned is if we are interfacing with a third-party application that, may be homegrown, maybe custom, they may have done that it may have created over the years. That's really where it can get a little tricky. And so there'll be some interfaces that are pretty seamless, and then some that will require a little bit more work. And so seeing from the potential partners and vendors how they approach those more modern interfaces versus the interfaces that are with a small nonprofit that may have a homegrown solution, how do they approach those in their experience? And so there are kind of two distinctions there that would be interesting to see what the respondents, how they've approached that over time.
Can I repeat that back to you to make sure that I capture this for the ITN? And in essence, we want to ask a question that says, how do you approach building interfaces, those third-party integrators, with readily available solutions on the marketplace?
Right.
And then the subsequent question is, how do you do that and provide examples of where you've done that with like custom coded, I think we use the term homegrown solutions.
Absolutely.
For example, I know when we go on to Salesforce, it gives you that list of a bazillion apps that it already interfaces with. It's already developed. But with Salesforce, if you're one of their subscribers, right, you can say, I have a solution that I want to use that's not listed here. You click a little button, they call you, and then they say, talk us through it. And I'm sure you get charged and things like that. I don't know fully how that works. But yeah.
Yeah, you got it. That's exactly right.
Marcus, you're putting things in the chat. Would you mind coming on and telling us what you're like, so we can provide context and so that I can get it recorded onto for our archive purposes?
So, yeah, I've been trying to listen to this conversation for the last 35 minutes, and I kind of have an alternative point of view. And I just wanted to let the discussion kind of unfold. I think that you're taking yourself down to a path that you're going to find it's extremely complicated and much more difficult to accomplish than you think that it's going to be. So I have concerns about I would put it on your diagram. I think that that's definitely a value, but I think you're going down a path that is going to be much more complex than you are prepared for. So the other part on the infrastructure side, when we're talking about all the data moves, there's all kinds of companies out there that will do ETL processes and things of that nature to move your data around. You just need it's whether it's inherent with the platforms that you're already subscribed to or not. There are providers out there that are third party that will help you set up ETL. The other thing is that my experience with these platforms like Paychex and all these other different applications working together is not necessarily as accurate in my experience. Here at CHS, we have all kinds of problems where we have multiple applications that do not integrate, they will not integrate, they will not play in the same sandbox. So we have to go to third-party integrators such as MuleSoft or JitBidder or something of that nature to then build an API because they won't do it for you. The other thing is you're talking about spaces where people are in competition. So if they are competitors to each other, they're not going to build a third-party integration tool that will work. So I think that you put it on your diagram. I think that this new edition that came out is something you definitely plan for a 3 or 4 year objective. If you find a vendor that will do it, that's wonderful. But I think that you're finding yourself down to a position of super complexity of that. You're not going to get a lot of responses, or they're going to get we work with this partner, that partner. You're going to find now you've got a network of 10 or 12 partners that will work together. And how are you going to weigh all that together? So my take is to take this back down to a simple thing. You had a good plan already. Put a wallet. And I was already kind of confused by the public comments. And as the conversation ensued for 35 minutes, I'm even more confused now than I was based on the initial comments that were made in the first 10 minutes. So I'm actually kind of lost about all of that at this stage, but I understand the concept of the wallet. And with that, there's all kinds of vendors out there that will develop that for you, but I'm worried that you're taking yourself down a path. If you try to do one big RFI with all of this stuff built into it, you're going to be reviewing RFPs and RFIs and 10 different vendors to figure out how they're all going to work well to each other. And that's my concern. But
so Marcus, So Marcus, let me ask this question. Let me tell you what my fear is though.
Yeah.
And maybe you guys can alleviate that. My fear is that we have these ideas and we don't put them out there, and then we end up with a system that doesn't allow us to expand with the ideas that we have. And if I'm hearing you correctly, what you're saying is, because of course I come from your world, and so full disclosure, Marcus and I work together, and I used to tell him, you know, some of my frustration. And I used to also tell him, if you got a solution, make my region the first one to test it out, because I love solutions and I love technology. And if there's a way to do it better, quicker, faster, I want to be the one to try that. So I don't want CSC to get into a situation where we want to do this additional thing. We're ready to do this additional thing, and it's going to cost us more now than if we had said we wanted to do it earlier. So if I'm understanding what you're saying is, we had a good plan, had a good draft process, draft RFP, go ahead and add this stuff to our diagram, to our big plan, but maybe just ask for what it is we need, understanding that there are third-party companies out there that if we want to build it out, if it doesn't talk to what we have, we can look at a third-party company to help us bring the two together. Is that, am I simplifying that down right?
That's been my experience, you know, and there are vendors out there that their purpose of existence is to build integrations where integrations do not currently exist.
Okay.
But again, I do think you add that to your roadmap plan and to the diagram. I do, but it's like Legos. You know, is you were using the house analogy. You know, in the beginning is, you know, a house you're going to build in 6 or 7 months, and you know how it's all, you got your construction person, they know how to build it. All they need is a blueprint, right? Technology is a little bit different, but I like the analogy. If the other part you mentioned earlier too, Sika, that technology changes over time, right? So if you build something now and you have it on your roadmap in year 3, we're going to do this, the way you thought you were going to do it will be different, but it will still be doable. Okay. But I think you share the vision with your vendors of where we ultimately want to go. I do, absolutely. But you're also, now I'm talking to 5 different vendors that I'm asking now to work well together. Some will, some won't. Some already have established relationships, some don't. So now you're looking into this third party thing, like the data moves, like Eddie was talking about earlier about moving the data around. There's ETL companies out there that do that all the time. That's why they exist. So my concern is that if you try to do one RFP or RFI for all of this, I think that's unrealistic to me. Now, because the technology changes and it's going to be extremely complex, is what you're adding more complexity as you build this.
Right. And so let me say, and Holly, correct me if I'm wrong, I don't know that we were trying to get somebody to tell us how much it would cost to do this wallet, but rather keep in mind that this is where we want to go.
Yes.
So just keep that in mind as you give us whatever it is you're giving us for what we need right now, but we'll necessarily need your proposal on this, but this is where we think we want to be. This is what we want to be when we grow up. This is at least what we think. And we just want you to keep that in mind as you're giving us your solutions to what we need in the next 12 to 18 months.
I would add one caveat. We're planning to do an invitation to negotiate and not an RFP. So it has, so how we set up that procurement, and we have said you do not have to apply for every, like you do not have to come with a solution for every single one of the elements, but you do have to say, I'm applying for this part of the solution. And if that's all you're applying for, you have to say how I will integrate with these other points. And then you would have the opportunity to provide a suggestion for a particular vendor, something like that, is how we've been kind of designing it. I think to your point, Mr. Johnson, you're saying that that's all, we might find ourselves negotiating with 5 different vendors and telling them to work nice in the sandbox. But so I think that hearing that and then hearing what Sika's just kind of described is that we say, this is where we're going. These are our year 2 goals, or year 1, year 2, year 3. Go ahead and project. I'm applying for this component, and I can. And this is how I plan to integrate with that. But this particular proposal is only seeking for the year 1 implementation. But we're having them think.
Right?
Is
Because
that a good middle ground?
I don't want to see a proposal for year 2 now. Right. So I don't want you to apply now for something that we're not going to do to year 2 or year 3, because year 2 or year 3 may not come. And when I say that, I just mean we may be in a point where we are extending what we have before we get there. So in my mind, when you apply, you're applying for year 1, understanding, yeah, I have the capability. I see where you want to go. And we might be able to provide a solution where you want to go. Yes. But right now, I only want, this is just me, and all you IT people tell me if I'm thinking bad. I want to look at a proposal that's going to help me out in the next 12 to 18 months. I really can't focus. I know we want the wallet, but the wallet is not year 1, probably not year 2. And I would prefer not to really look at that. But what I know is you gave us a proposal where you could build out the wallet later on or get us in that place. Am I kind of?
You want to vision cast, share with them the vision, but right now we're interested in proposals for this. But you have to understand that what you're proposing is a part of this longer vision. That's what I'm saying. My worry was in the conversation as I was interpreting it, going, holy cow, you guys are going to go out there to do an RFP that I want to put all of this together. And that's where I'm like, that's unrealistic. And right. You're going to find yourself in a very complex, confusing situation. But give them your vision. Like at CHS, we have a 3-year roadmap. And that's what Sika, as she was walking out of the organization, we were finalizing that. I'm only doing year 1 at a time. But we have now established strategic partners with multiple vendors. We have now strategic partnerships. They know where I want to be in 2025. They are all contributing today to where, and they know where I want CHS to be in 2025, and they understand how these things layer to get to that. I hope I didn't confuse or muddy or anything. I was getting a little concerned in the conversation that you were going to have this big RFP and you'd be too much.
No, that was perfect.
Okay.
Because Holly and I can dream, I'm telling you, we can dream all the way up, and God help if I ever win the lottery, then this won't even be an issue, right? But the probability of that is pretty low, and it's all good. So no, Marcus, I think you made us more clearly define the big picture. This is what we're wanting, knowing that things could change along the way, but this is what we need now. And we just want you to have the same vision, share our vision for where we want to be. And then you have the ability to say, yeah, we want to be there with you. Or when we get to that point, we could issue another ITN.
You want these partners to be partners to
Yes.
help you achieve your vision.
Got it.
So, yeah.
So I did pull up the work plan phase. Clearly, we need to make sure that this reflects the second bit. Sorry, guys, I'm getting that weird unstable internet thing. Am I sounding like I'm in a vacuum? Oh, okay,
You're
I'm
good.
not.
You were great.
Okay, I was like, whoa, wait, what's happening? So clearly we're going to need to add something, but I did want to kind of reflect back where the changes that we made based on what you talked about previously, and then to make sure that we add in this next phase into this that reflects the conversation that that we just had. So
So Holly, let me ask Holly and
Sure.
see. So do you have to do that with what we just discussed? Because it sounds like you may not have to per se add in here in this particular document, year 1, year 2, X, Y, and Z, but maybe there's just an avenue to whatever we put out there. We just have a separate visioning document that articulates what we're trying to do. But I don't know that I could be wrong. I don't know that it impacts this.
Yeah, I was going to say, I don't know that we need to clearly define year 2, year 3. I do think we need to add something that gives the vision for where we're trying to go, because any company that responds that is worth their salt will see that. And we could ask them, give us a paragraph, give us a whatever on our vision and how you see you fit yourself, your company fitting into that. But I don't think we have to define in year 1, this is what we plan, year 2, this is what we plan, year 3, this is what we plan into this. And so I don't know that it will affect the work plan in as dramatic a way as maybe we initially thought at the beginning of this committee meeting.
And let me add to that group, because originally too, why we brought that up is we didn't want to, if it was appropriate, miss that opportunity if we were needing to articulate in that group. Should we be asking for these potential, solutions to address if they can do this or not? I think possibly what we came to a consensus on right now, or if we need to, is that we would leave it the way that it is, add additional information separate from that about what the vision is, and allow them to address that, hey, in the future, we totally have the capability to do X, Y, and Z or however, but we're not going to then ask them to propose that, yes, we can do this wallet, or I'm paraphrasing.
Mm-hmm.
Yes, okay.
That's what I think.
I think we're all saying the same thing. I was suggesting we review it and make sure that that is consistent with it, and that you're right, that we might not have to add or change anything to the work plan. But I wanted us to go over and explain to the group what we did edit from the last time based on the feedback, so that everyone can see that, make sure that we're in agreement, and that, to your point, we don't need to add anything. But I just want to make sure.
Nope, I think that's right, Holly.
Okay. Okay, so I'm paraphrasing. This might be then the final version based on this conversation, but clearly we'll need to add somewhere in the ITN the full vision. Okay, ACEs. So what we did based on the conversation that you had last time is that we created 3 primary phases: market research, procurement, and then implementation. So under market research, really spelling out what we're doing from the close of that RFI, the beginning of this work group, through to the potential release of the ITN. So our goal is to have everything kind of done and dusted in terms of gathering all the requirements and the design, and that kind of the full production of that ITN, have that completed at the end of May so that we can present it to our council at our June meeting for that release of July 1 that we talked about in the timeline last time. This allows just for more demonstrations, talking to those provider stakeholders, like Spirit potentially, just so that we're, of course, just getting that information now, understanding that's fully a year 2 or year 3, whatever it might be, for the intelligent referral tool, as well as potentially that wallet. But it just does give us the ability just to kind of get everything designed and in order. So we have our map, we have a designated scope of services that we're going to want to build, and that kind of opens this up until we, in essence, close that cone of silence. And what I mean by that is based on your recommendations, I have been meeting with vendors, of course, all of the ones that have submitted, and I have time with each of them. We're meeting with WebAuthor and Unite Us is next. And then there's been a couple of others that have been referred to us by some of our community providers just to look at and just continue that market research phase. So that's kind of all in that section. Then going into the procurement phase, and that is the official solicitation, evaluation, and negotiation, and contract development. And this is timed out based on our council meetings and that timeline of scheduled activities that we had. It also includes the opportunity for a letter of intent and the question submittal response. So there's that written piece, and also time for doing live demonstrations with the selection team. And then the final piece, of course, is the implementation. And previously it just had that, the system development, the testing and evaluation, kind of based on your feedback last time, not necessarily doing that in a linear path, but kind of two cogs turning at the same time. And then we added a section at the end based on your feedback that's dedicated to support. And defining that based on their proposal of when that contract might end. Based on the demonstrations and conversations with vendors, that can be designated as a bucket of time, or they can say, a post go live moment, it might be a bucket of hours that you just draw from until those hours are gone in terms of that ongoing support. It might be we provide up to 20 hours a month until 6 months post out, like whatever it might be. We'll let them propose to us how they, what their kind of MO is and what they're suggesting for that support. Of course, because we're going to do the negotiation process, if we hear, oh, we like this model better from vendor A, and vendor B has a different one, we can always go to vendor B and say, hey, on that support section, we'd be interested in you pitching it this way versus that way. So that's kind of the changes that we made based on last month's discussion, and based on this morning, I still think that this works as long as we're very clear what we're wanting to achieve by that go live date of April 1st and being realistic in that. Any questions or additional revisions?
Thank you, Holly, for that. I don't think, does the group have any? Okay, I see heads, okay. So I think we're good.
I adequately caught everything that you guys reported, I think.
Yeah.
And so
Holly,
thankful
you've
for
done
the
a great job on this. Let me
Good
just publicly say that she has become our ITN RFP SME, subject matter expert, for sure.
Excellent job.
Yep.
Awesome.
Well, if that's the case, we'll go on to the next topic, which were goal statements. If, Holly, I think that's on page 5. You're going to pull that up. We just need to review that and see if you guys had any changes, recommendations, or updates on that. And that was the list of goal statements.
And full disclosure, I did not change anything. When I went back and listened to the recording, nobody said anything during this. I think that this will be goals of this particular RFP, but before that, we will do a vision, we'll add in a vision paragraph.
Yeah, that's correct. There weren't any. I'm sorry, Terrence. I'm shutting up.
No, you're right. No, you're right. No, there weren't any. We just were giving people the opportunity to come back to this one if they had anything after some further deliberation. So if we are good on that one, we can move on to the next thing. So that's page 7, which is the evaluation criteria. We did have some discussions around that, so we can take a look at that and see if we are okay with that, want to revise anything, and then allow Holly to kind of articulate or addressed further. So this was, again, this is when it goes out and the the evaluation team is evaluating and they're scoring the different proposal. This is what they will use to score each section that the potential folks submitting will be, scored on. So
if I may, Mr. Chair, this is not the numbering that you guys kind of collectively decided upon. And I'd like to tell you why. And based on a conversation that I had with procurement specialists and our experience internally with the IT team that we did for the needs assessment. And so I'd like to just take a quick moment to explain that. But I'm happy to switch it back and do whatever the will of the group is. One of the recommendations was to bring the vendor profile down to 5. What we added since then is this idea of getting references. A lot of what you talked about, while it wasn't during this conversation, was how have they helped and worked with other different types of program providers, even the conversation that we were just having about, and while we might not be getting to those ETL processes, how do you, asking those questions about like, how do you approach building those interfaces with an established program versus a homegrown, and could you provide us references or whatever that looks like, and to be able to kind of explore those. So that's why putting into a section that actually calls that, in essence, forces us to call those references before we shortlist. And that was one of the lessons learned in talking to some of the other CSCs, that while they could do a scoring and then shortlist and then check references, they found themselves wishing that they would have checked the references beforehand. So that's why I pumped it back up to 10. I think it was 15 before, so we bumped it back up to 10. So that's the main change for this section. The next kind of these next software applications didn't change, that stayed at 15. On the next 3 sections, that is where we see the technology platform, the implementation services, and then the ongoing training and support. We did add in, based on your discussion, being inclusive and expanding that definition, that it wasn't just training, it needed to be ongoing training and support. And then just making the determination to equally weight these. I think that the recommendation at one point was that ongoing training and support services would be higher, and then these would be lower. But the idea here would be that it's equally as important that the infrastructure that they're building is solid, that the implementation services, including the team that would be building them, and just their history of meeting those goals and desires and staying within budget, is just as important as that ongoing, so that they're all kind of equally weighted. Again, that was a recommendation from conversations with a sister CSC of which one of these is more important. And their recommendation was that they were all equal, so wanting to have kind of that equal weighting. And then the final section was cost. Previously, this was a lower number, and so this was increased up to 20 based on the recommendations by the group. And so if my math is correct, I think my math is correct, it still should equal 100. So I'm just making sure 60. And I don't know that it fully does. I'll double check to make sure that it does, but it should. Yes, it does. So those were the changes that we made. But again, those were post conversations after your discussion with sister CSCs. And so happy to do whatever the will of the group is.
Well, go ahead, Mr. Johnson.
Yeah, I think this is going to be more of a philosophical piece more than anything else. I know cost is important, but you're adding a lot more weight to the cost. I mean, the software application, I agree with the software piece having the weight, because that's really the functionality that you're looking for, right? That's where your user experience and your user interface is going to sit. So I think that that's very fair. you're giving a lot of weight to cost. And I know that obviously budgets are always a concern, but is that really where do you really weigh cost on equal with the software piece? I don't know, did that make sense? You're putting a lot of weight in the cost. Should it?
Yeah, so it does, and I think I would lean toward agreeing with you, Marcus. And so what I'm wondering is if we are able to reduce that a bit, because this is an ITN. So that means that we can not only negotiate services, but negotiate some of the pricing that they give us. And I do not think that cost and software should weigh the same. I think the functionality has to weigh more than what we pay, because the reality is we get what we pay for. Now, you know.
I agree.
So,
We were aligned there. See, I think your software application should weigh heavier because that's the UI and the user experience. And if they don't like that, you're going to have an adoption challenge, right?
So would it make sense for software to be a fourth of the scoring at 25?
I think you're going to get philosophical, obviously some things. I think 20 is probably okay. I don't know. I'd probably reduce cost to 15, and then I would give more to your ongoing training and support, right?
Okay.
So if that your training and your support is also going to impact your success on adoption, right? And again, I suspect you're going to get 3 different opinions on that based on philosophical take, but I didn't feel that cost and software should be equally weighed.
So philosophically, what are the 2 most important? I'm sorry, Chair Watts. Philosophically, if I think, what are the 2 most important things to me if money were no object? It would be making sure the software works and supporting me once it's done. Those would be the 2 things that I need, because if I don't know how to use it and I got to beat the phone down to try to get you, then that's a problem for me.
And a cost. And a potential future cost.
Your ongoing maintenance and support costs and all that, right? Because you don't have in-house talent to do this. So, right, you're going to have like higher managed service type arrangement, right? You're going to ask for a higher tier support model than if you had some in-house folks that could do some tier 1 type of thing. Yeah, to me, and this is just, again, my opinion, I'm sure there may be different ones out there, is software should be high, and then your training and support should be high. I mean, and then maybe the cost needs to be a factor. I wouldn't take it to a 5 or a 10 because you got a limited dollar. I'm sure you don't have like an unlimited bank account for this. So I think cost should weigh high. Don't get me wrong.
I saw Eddie light up, and then I also saw your message. Eddie, did you want to?
No, I think Marcus's comments are reasonable. I think it makes sense, and I have no objections.
Holly, do you have any additional information as to why they chose to or recommended that cost should be high?
Well, it was actually you, Mr. Watts, at our last meeting who requested that it go up to 20. So I think that the idea, I do think that cost is important, and if the group is willing to take the 5 from there and put that onto ongoing training and support services, that would kind of come out to where Mr. Johnson is recommending it. The thing that I heard, and I don't know if Mr. Watts just said it, or if we've been saying it, is if they're really expensive up front, and maybe under the cost section, we can just beef up the description a little bit, because if they're really expensive up front and that managed support is also expensive, then I am thinking about our referral intelligence tool and case management. I am thinking about the wallet. How expensive is that going to be? Like those ETL services, for example, if they're really expensive to do this stuff, which I'm going to call it basic. I know it's not basic, but I feel like it's basic compared to what we're talking about doing in the future. So I'm like, oh, this is the easy stuff, and it's still not easy. And I'm fully aware of that. but I'm also cognizant of some of the conversations that I'm having with vendors about the cost of this, but venturing into the future, I guess my point is, I think the cost is absolutely relevant. And to your point, Mr. Johnson, like you're not suggesting take it down to 5 or 10, which is what I think it was at before, but maybe not doubling it to 20, and maybe finding that middle ground at 15 would be amenable to the group.
Right.
Okay, go ahead.
Go ahead, Chair Watts.
Oh, no, I was just going to say, so ultimately the changes from what we decided on the last time would be the first one, we had that at a 5. We had the first option at a 5, vendor profile and references, we recommended as a 5, right?
You had recommended to take it down to a 5, and I politely declined, and based on the sister CSC talking about references and giving the opportunity to weight that and requiring that those all be done before scoring occurs.
Okay, and then for did we rate the ongoing training and support to a 20? I don't have my original with me.
That is correct. So the recommendation was that ongoing training and support services would be 20, and instead of having all of these equal. And so, and actually, I think that technology platform, you guys had recommended, the implementation services, you had recommended to take down to 10 and have ongoing training go up to 20. And instead of doing that, split the difference and kept them equal, because per the other conversations I had, they were saying that all of those were equally important. But I'm hearing the will of the group is saying that maybe that ongoing training and support services, which I do plan to add, and I think it'll maybe go into the cost section of that conversation about the ongoing cost related to support, because it is that kind of not longer term. So maybe that is more important.
And then let me offer this as well. I think that the ongoing training and support for us, I think, which was actually previously mentioned, has to be higher, because we still and will not have near the team that they have. We won't even have anybody that we could teach tier 1 to. Like they could be the tier 1 person. Holly is pretty good and I'm dangerous, but not with any of this. So from my standpoint, I'm okay with lowering the price, because again, A, we get what we pay for. B, we are looking at something long-term. C, I feel like I could justify that. Like I could justify whatever price we end up, wherever we end up, because we are looking at a long-term. We're not looking at, something to just get us by. I mean, we'll use Excel spreadsheets until we get it where we need it to be. So I'm okay with lowering the price to fit the points for the price to 15. I don't think we go any lower than that, because I think Chair Watts is correct. Price has to be a factor. The next thing I will say is, any company that responds to this, I hope, goes to our website, looks at the budget we've approved, looks at how we come up about our budget, and looks at what we propose to bring in every year when it comes to the funding that we will have for children and services. So any company that comes back and says this is going to cost $1.5 million, that's a 1, and that's what you're getting in scoring, because you're not taking into account everything that goes into what it is we're trying to do. And we know that there are companies out there that have told us it's $1 million. Oh, okay, well then you don't need to worry about submitting a bid, because you may even get a 0 on that, if that makes sense what I'm saying.
I want to throw something out there, and you may have said it while I stepped away, so I apologize if this is duplicating, but if we did leave it at 15, the ongoing training, but then you did incorporate the cost of the ongoing training into the cost portion, then you kind of get the best of both worlds, in making how they do it, you know, on par with the implementation and the platform itself, but the cost of it will then be in that 20% or 20 points piece. So I think you could kind of look at it either way. Or
So Corey, what you're saying is in the cost portion, have a piece of that not only includes the cost to implement it, but the cost for the oversight and support, then that might be able to justify leaving that at a 20.
right. For instance, you know, maybe they do have different tiers. They may not have somebody who can support you at the level that you need. You know, and that may be okay, because then maybe you contract locally with someone. That's what our office does, who kind of does that piece. You know, so you could kind of look at it different ways with that, knowing what they have available and what they charge for that.
Got it. Any feedback on what Corey in the previous discussion just entailed? I saw Holly making the edits there as we were talking, so
I'm happy to make them back though, so.
From my point of view, I like that option. And I saw Marcus shaking his head like, okay, if that is done, then I can kind of see where you have the points where they are, because effectively you're talking about two pieces in there. Cost for implementation and software, and then the cost for the ongoing support, maybe.
Yeah, again, these are kind of like philosophical points is the way I look at it. And I'm just trying to look after your best effort, your best interests, which is you're not going to have anybody at all on staff to help with this. So you're going to need some good support, right? And the cost of that support is definitely going to be a factor. Whether I like where Corey was talking about, you may have a third party managed service provider that manages that for you. It doesn't have to be the vendor, just somebody that is versed in whatever solution that you end up with, right? So.
all right, so with that,
You have consensus?
Holly, can you go through where we are, please?
Yeah.
So that I'm sure that's what Chair Watts was getting ready to do.
Sure. So basically we would, the version that you have in your packets delivered to you, in essence, it would stay the same. So based on this last conversation, it would keep ongoing training and support services at 15. And then under cost, it would keep it at 20, but we would alter the definitions and the scoring criteria of why you might rank someone higher, kind of breaking it into those two sections of, or not, and I wouldn't say two sections, but just including the ongoing support and what that looks like. So just really beefing up the language. While this is just the original criteria, the ITN will include the actual like the breakdown of like how someone might score higher. So we would want to definitely include in this definition a little bit more detail related to that ongoing support, potentially maybe even adding something along the lines of ongoing support parentheses, maybe give them a for example, give them kind of 3 options, including third party managed whatever. So that it's very clear in the proposal that the vendor is saying, we have the entire team that can do this, and this is going to be the cost of it. Or we don't have the entire team to do this, and we don't have those, we can't meet those costs. So while I can easily pull up on the screen the actual, where we kind of landed, I will kind of tweak the language under the cost header box.
Does the group have any questions on that, or? Okay.
So yeah, so it does go back and stays the same to what's in your packet.
Okay, if nothing else on that, okay, we're going to move on to page 8, schedule of activities. And this, I can't remember from the last meeting or not. I should remember, but this was and this actual review is based on some other conversations with other sister CSCs, and then also previous experience with needs assessment and timeline. So does anybody have any comments or feedback on this particular activity schedule? From your experiences. It seemed too aggressive. It seems, you know.
I think the only thing that we kind of changed or added based on last meeting was this line here about vendor visits and demonstrations, that was giving the opportunity for them to actually demo do a demonstration for us that the evaluators could score. And what that would do in terms of the scoring criteria is related to that ease of use. I think that to Mr. Johnson's point that he made earlier, that the user experience is going to be huge, which is why it's ranked pretty high. And how do you get that user experience? By reading a piece of paper. So that's why we incorporated that piece. So the vendor notice of intent to respond, in essence, would be that, okay, you're going to submit that, but you're going to be able to do a very brief demonstration, and the requirements for that demonstration would be spelled out so that when the evaluators look at the proposal, they can also have the opportunity to have interface with one to see that ease of use. So that's the only thing that changed. And then they would, of course, evaluate, select those top proposals for negotiation, and then go into the negotiation section. So it's a little bit different from the process that we used for the CSC needs assessment. So that's really just for Sika and Terrence's perspectives, because we're being intentional about doing a demonstration as part of the evaluation.
Okay. Sounds good to me. Does anybody have any questions or comments? Okay. Next on our agenda, I think we possibly handled this already, but this is around the draft information systems map. So that's what Holly shared earlier. So we pretty much had that discussion. I'll just open up, Holly, if there's anything we missed that. No, we're good? Okay, all right. So next, all right, so staff have requested that we reconvene the work group closer to the conclusion.
Oh, sorry, Mr. Chair.
Yes.
There was one other thing under that section, and that's the technical features.
Okay.
And so you'll find that in your packet on pages 9 through 24. And while I don't anticipate that we would go through all of that now, because we still have a little bit more of that research that we want to do, I just wanted, this was how one of the sister CSCs did their RFP for kind of each of them is asking these 3 questions. So if you flip in your packet to that, and if you want me to bring it up on the screen, I certainly can. In fact, I will. But basically, it was just asking, as part of the checklist when it comes to scoring, are these elements, so this would be part of the ITN for each of the little pieces, all of these questions that we ask them to do. These are almost like the kind of the check yes or no type of responses. Is it available out of the box? Does it require just, a basic configuration that hopefully, and you'll see in some of the questions that can be managed internally. Some of the questions, Eddie, that you were asking about is like, can staff have the ability to kind of craft some of these features? Like, is it easy like that? Like I use the very basic idea of like a Google form, right? Like, I can go in the Google form and create whatever I want. clearly it's going to be a little bit more in depth than that, or does it require customization and support for each of those? So the idea that we said at the very beginning of one of our goals is that we want to as much available out of the box solutions as possible, but then this will give us a nice score sheet. Originally, I was going to come here and say, clearly, if we're going to be adding the referral intelligence software tool and the wallet, that we need to grow this, but maybe we don't. But I mean, that's something that we can go.
If you look at, if you do a search, or, you know, for integration, the word integration, it's all over the features list, and which is great because it's kind of a follow up. I mean, API integration is there, and you mentioned Salesforce and ArcGIS, and to Marcus's point, we're not trying to get too complicated and try to solve the world's problems with with this ITN, but we've got it all over, which is going to be great to see how people respond to it. So excellent.
Right, and Corey did have to leave off, and she just asked that if we, had anything additional, just to let her know. So Holly, let me just do one more follow up. Do you want to address the information about, possible getting back together around discussion of case management options, or?
I think that based on your discussion earlier, that we're good from that perspective. I would love if we could, at the end of May, when we do have the final scope of services with that map and the vision, and maybe that can even just be done via email, that we distributed, and that, but again, it's gonna be closer to the end of May, and that you just provide any feedback, and if we need to meet, we could. That's one option. Or if we need to formally come together, maybe it's for 45 minutes to offer any suggestions. That's another option. I do think, though, that there was one more item on the agenda related to subject matter experts for the evaluation process.
I will go ahead and propose. I'm okay with whatever the team would like to do. I wouldn't mind an additional meeting, and trust me, I'm not a fan of meetings, so me saying that is just because I'm possibly enjoying this. But I think that an additional meeting for that discussion and just see it all come together. That's my take on it. But I mean, I'm up for whatever the group wants to do. Okay. All right, so we can go that route then, and so next is evaluation team recommendation. So we would like to have a very brief discussion. I definitely see us getting out of here on time around if you guys have any proposals to people locally in the community that you think might be appropriate to serve on the evaluation team. If I'm not mistaken, even if you yourselves are interested in participating in the evaluation team process, that is allowable as well. And it will also be, they have determined that it's going to be an invitation to negotiate. So it will require both evaluation and negotiation teams. So I will open it up. If you are interested, let's do it like this. Is anyone on the call interested in being a part of the evaluation team? It is a great process. Now, I haven't volunteered myself just yet, but I'm opening it up to the team if you're interested in participating in that.
For me, I think I don't know that I can, because I'm too far away from the I'm not local, and it would be a pretty significant drive for me to participate. So I don't know that I would be able to participate in that, unfortunately.
Okay, fair enough. What about you, Eddie?
Yeah, I'd love to continue helping. I think the process has been great. It's been smooth. The staff, you, Mr. Chair, have been great. So look forward to the next step.
Okay, awesome. And on that, let me ask you, Eddie, do you have anyone else that you can recommend that you feel like may want to participate, and that we could reach out to, to participate?
I may have a few, Mr. Chair.
Okay.
And they happen to be technology folks who also may be interested. So I have to make sure that they're aware, we definitely don't want a conflict of interest, but I'll definitely sleep on it and provide those.
That sounds great. Holly and Sika, let me ask you if it's okay for people to think about that and have a time frame to get back with you. What would be reasonable?
By the 14th, or let's say instead by the 13th, so next Wednesday, so that we can include that and kind of like the public notice, or if we need to take it to the full council to brainstorm with them. And to also determine if there's other council members who would like to participate. I know that there's one council member in mind who would be great in this process. However, she has requested to not be involved with this due to, there's no conflict of interest, but perception, just because she definitely has strong opinions about things. So, but we'd like to have the opportunity that if there's other council members that have felt that they haven't been invited to this process and they wanted to serve in that capacity, that they could. But so from this internally, be able to come to the table with a list of recommendations for the council to consider, and then adding on to council members. And the reason why I asked for by the close of business next Wednesday is so that we can have our packet prepared for the council on the 14th.
I think that's great. And from my point of view, I'm not going to volunteer just now. I'm going to wait to see if you have enough. And then if you need someone, then, you know, you can sign me up. No problem. And I'd love to do it. So that's my take on it.
Awesome.
Okay. Do I ask? Okay. So with that said, if we have nothing additional and I have everything covered, our next meeting date will possibly be when?
So we talked about the end of May or early June. I realized as soon as I said end of May that there's a holiday weekend in there, right? Memorial Day. So I could just do a doodle poll and see what comes out as best. Is that the better? Especially because Corey had to leave and Darren couldn't be here. Is that okay?
Yes.
Okay.
There was, okay.
Yep, that's fine. And then will someone reach out to Corey about okay, all right.
About the SMEs, Tara, yes, sir, we will.
Okay. Oh, and Mr. Toston.
Yes.
Okay. Well, next meeting agenda will be based on the discussion today. Any worker member comments, additional comments? Okay, and if no closing thoughts, we are adjourned.
1:45 p.m. Thanks, everyone.
All right, thank you.
Thank you, everyone.
Okay.